The NCLEX is unique because it evaluates clinical judgment and decision-making, not just knowledge. For instance, when a patient has low oxygen saturation, the test prioritizes interventions like the ABCs, airway, breathing, circulation, over mere factual recall. Spaced recall is crucial for long-term memory retention. By reviewing content at intervals, such as cardiac medications at 24 hours, 3 days, 1 week, and 2 weeks, learners can strengthen retention and reduce forgetting, leading to mastery. NCLEX-style questions simulate real-life nursing scenarios. For example, deciding whether to elevate the head of the bed or administer oxygen for a patient with dyspnea tests clinical judgment, mirroring real-world decision-making. The teach-back method reinforces mastery by having learners explain content to peers. For example, teaching diabetic ketoacidosis management, as if giving a bedside report, strengthens recall and understanding. Mock exams act as rehearsal shifts, simulating the exam environment. Full-length practice exams, with 75 to 145 questions, help build stamina and pacing, mirroring the real testing experience. The ABCs, airway, breathing, circulation, ensure safety-driven priorities. For instance, in cases of chest pain and low oxygen, addressing airway and oxygen needs comes before administering pain medication. Maslow's hierarchy in action emphasizes addressing basic physiological needs before psychological ones. For example, administering fluids for dehydration takes precedence over addressing anxiety. Safety and risk reduction involve choosing interventions that prevent the greatest harm. For seizure precautions, placing padding before administering PRN medications is a priority to ensure patient safety. The clinical judgment model in the next-gen NCLEX focuses on recognizing and analyzing cues. For example, interpreting abnormal vitals as signs of sepsis leads to timely interventions, enhancing patient outcomes. Connecting studies to real care is essential. Knowledge directly links to bedside practice, such as understanding insulin peaks to prevent hypoglycemia in patients using NPH insulin, ensuring effective patient management. Evidence-based prioritization ensures decisions follow guidelines. For instance, sepsis bundles guide the administration of fluids and antibiotics within 1 hour, optimizing patient care and outcomes. Integrating pharmacology into practice requires understanding medication mechanisms. Knowing the effects of beta blockers, for example, helps anticipate and manage the risk of bradycardia, ensuring safe medication practices. Reviewing by body systems organizes study effectively. Breaking content into systems, such as respiratory issues like COPD and asthma, helps prioritize oxygen delivery and enhances understanding of care priorities. The mind-body connection highlights the importance of stress reduction and rest. Practices like sleep hygiene consolidate memory and enhance recall, improving focus and retention of study content. Simulation and case studies apply knowledge in clinical settings. Managing scenarios like postpartum hemorrhage in case studies strengthens readiness and mirrors real-life clinical decision-making. Analyzing rationales in practice questions is a learning opportunity. For example, choosing heparin over aspirin in DVT tests, rationale-based decision-making, enhancing understanding of clinical choices. Cross-linking concepts strengthens understanding by connecting content areas. Linking renal failure to electrolyte imbalance, for instance, improves fluid management decisions and enhances clinical judgment. Measuring progress involves tracking weak areas to direct study focus. If struggling with psych meds, for example, increasing practice in that domain helps improve understanding and performance. Approach NCLEX preparation, like clinical training. Practicing scenarios instead of memorizing lists mirrors nursing practice, enhancing readiness and application of knowledge in real-world settings. The NCLEX serves as a bridge to practice. Each question reflects real-life responsibility for patient safety and outcomes, emphasizing the importance of clinical judgment and decision-making in nursing.